I want to thank you for joining us on the Zoom call. We are excited to be here to present this program to you. We all know that one of our most valuable benefits is our health insurance. And I'm pleased to say that we have found a way to continue to provide the high level of health benefits that you are accustomed to at a lower cost. The advantage to you is that the premium cost is being reduced, and therefore the amount of your contribution will decrease proportionately. Each employee's contribution is different, as it is based on plan selection and salary. So each person's savings will be different. We calculated an average savings of about 10% of your current contributions. To determine what your savings will be, you can look at your paycheck. There is a line on the paycheck for your employee benefit contributions. You can take 10% of that number to see what your savings will be every 2 weeks. Health benefits are a cost that escalate annually, usually by an amount that makes budgeting other expenses difficult. By implementing this plan, the district will also see some savings, which will help us in our budgeting process. This is all possible because of a change to how the plan will be structured. We have two great partners to help us through with this process, Alliant Benefits and the Difference Card. On our call today is Simone from Alliant Benefits and Scott Abrams from the Difference Card. They will review the process in detail and discuss the details of how you use the Difference Card. If you have questions, as Mike said, you can ask the questions as we go through this process through the chat function. You can also email me questions after the presentation, and either I will answer them or I'll forward them to Simone or Scott, who will respond, or I'll respond through, they'll respond through me. I have heard great things about both of them. We are new to the Alliant Difference team, but all of their references have said how great they are in customer support and getting us through this process. So welcome to both of them. And Simone, if you want to start, that would be great.
Sure. Thanks so much, Donna. Thanks everyone for being here this evening to educate yourselves on how the plans are going to work in conjunction with Cigna starting July 1st. So thank you for being part of the benefits training sessions. We're introducing the Difference Card, which is a new way to pay for your benefits. By introducing the Difference Card, there will be a decrease in the contribution costs that you pay for the medical plan. So that contribution out of your paycheck will be decreasing. The POS plan will work with the Difference Cards. However, your chosen doctors, hospitals, and other providers are going to remain the same. There is no change in your provider network or the doctors that you've been seeing previously, or facilities, labs, x-rays, etc. There's no change to any of that network. There's copay, deductible, and coinsurance amounts will also remain the same. The POS participants will receive a card from the Difference Card along with a Cigna card that's going to be a new card. If for some reason you do not receive your new Cigna card before July 1st, just please keep in mind that you can continue to use the card you have today. The ID numbers will not change on the card. So going forward, you should always have your Cigna card and your Difference Card together. So when you go to see the doctor, they're always going to be together. The Difference Card is MasterCard technology, and this is what it looks like. So you will present this to your provider in conjunction with your Cigna medical identification card. The Difference Card MasterCard technology is used to subsidize your medical expenses that are paid for by the Berkeley Heights Board of Education. The Difference Card is designed to keep the expenses the same as those that you incur under the current plan. Your Difference Card will be used to help pay for things like your office visit co-pays for specialist and primary care, visits to the urgent care, deductible and coinsurance expenses. Again, you will receive your card in the mail prior to the start of the plan on July 1st. If you have a spouse enrolled in the plan, they will also receive a card, and any dependent over the age of 18 will receive a card. Because it's MasterCard technology, if you have a dependent who's under 18, if you have expenses for that dependent, you will just need to use your card or your spouse's card for those expenses for anyone under the age of 18. A high-level summary of the difference of Cigna and the difference cards. So on the left-hand side is the current Cigna plan that you have today. So it's deductible, copay, coinsurance, out-of-pocket cost. The primary care physician copay is $15 and the specialist is $20. The purchase plan is going to have a higher deductible, copay, coinsurance, and out-of-pocket cost. The primary care physician specialist copays are going to be $35.40. However, you're not going to pay the $35 or $40. You're going to pay with the new Cigna plan aggregated with the difference card what you currently have today, which is $15 for primary care and $20 for specialists. And your deductibles, copays, coinsurance, out-of-pocket costs will all be subsidized, and the difference will be paid through the difference card. In this slide, we go over a high-level contribution summary. So keep in mind that introducing the new plan aggregated with the difference card, you're going to benefit in a reduction of contributions of approximately 10.3%. So here we show you two examples. An employee making $72,000 has a single coverage and pays 32% of the premium. So under the current plan, meaning the plan before the new one takes place July 1st, the rate with Cigna for this particular plan is $1,414.46. Your employer, Berkeley Heights, pays $961.83, and you, the employee, pay 32% of that, which is $452.63. The new plan that has the Cigna and the difference card together brings that single rate down to $1,268.14. Your employer paying $862.34, and you paying $405.80. So you're still paying the same percentage, but it's a percentage of a lower amount, and that's how you receive that discounted rate contribution out of your paycheck of 10.3%. The next example is an employee making $100,000 a year and paying 35% of their premium. This is a family rate with Cigna, current plan, at $2,929.55. Your employer paying 65% of that, which is $1,904.21. And you, the employee, paying 35% of that at $1,025.34. The new plan that goes into effect July 1st, the Cigna and the difference card together, that rate, family rate goes down to $2,626.50. Your employer is now paying $1,707.23, and you're now paying $919.27. Again, with that reduction in contribution of about 10.3%. Now I'm going to turn it over to Scott, and he's going to go over exactly how the difference card is going to work for you.
Thank you, Simone, and good afternoon, everyone. So I'm going to go through really the summary of your benefits and how your Cigna plan works with your difference card. In this grid, you'll notice your left-hand column is your benefits under your medical plan. That Cigna benefit is really the plan that Berkeley Heights is purchasing you'll notice it does have higher copays and deductibles, but of course you're not responsible for that. The difference card pays column might as well say Berkeley Heights Board of Ed pays, because that's what they're funding toward each of your benefits. That you pay column is what you're responsible for at the end of the day for your out-of-pocket expenses. You'll notice in the highlighted yellow what you're paying in your plan design and the out-of-pocket with your health insurance. It has not changed. Everything is remaining the same in terms of what your responsibility is when you go to the provider for copays and deductible expenses. So that's going to remain the same after July 1st. Really going through each benefit line by line, first we're at your office visit copays. So your primary care specialist copays. On that Cigna plan, you have a $35 copay at the primary care and a $40 copay at the specialist. You can present and swipe your difference card MasterCard for $20 at each, and your copay, your out-of-pocket remains the same at $15 for the primary care and $20 for the specialist. So really, and I'll just break down a scenario. Say I go to the primary care doctor the first week of July. They'll request a $35 copay. I provide my difference card MasterCard. It's just a MasterCard. And I ask them to swipe it for $20. Just like a medical gift card, it discounts your copay. You can pay the remaining amount of your responsibility with a different method of payment. It could be cash, different credit card, or even your FSA card if you do partake in the FSA plans. Now, we are going to provide stickers that you put on the front of your difference card MasterCard, so you don't have to memorize our presentation or your benefits off the top of your head. So you always know what amount to swipe for at each provider. We provide that resource to you. Now, the card is smart. It knows where to swipe and for what max limit. So it will only swipe at certain providers. That's your primary care, your specialist, and your urgent care copays. The card won't swipe at a Best Buy. It also won't swipe at the gas station. So just keep that in mind. Now going to your next benefit, your urgent care, you could swipe for $20 out of your difference card MasterCard, which discounts your copay, and then your remaining out of pocket is the same $50 urgent care copay that you're used to today. Now, when it comes to your deductible expenses, so your in-network deductible, this is your major medical benefits and not just your simple copays. Things that are triggered by your in-network deductible are hospital or facility-based charges, things like inpatient hospital stays or surgeries. You're not responsible for any amount of your in-network deductible. On this Cigna plan, you have a $2,500 deductible. The difference card will fund that full $2,500 amount, and so your out-of-pocket is zero. It's free for any deductible expense. So let's just use an example. Say I unfortunately trip and fall and break a leg. I'll be carted to the hospital. That hospital will take care of me, maybe conduct some surgery. I'll get discharged, and that hospital will send me a hospital bill. I'll also get an explanation of benefits from Cigna. Is that piece of paper that says this is not a bill, but it looks like a bill? Really, what it's going to show you of what that hospital and facility try to charge you, then what you're specifically responsible for because you have health insurance with Cigna. The explanation of benefits might say, Scott, you're responsible for $2,500 worth of your in-network deductible. What I then do with that EOB, or explanation of benefits, is submit it to the difference card. We'll go through how to submit. You can do it digitally through a mobile app. You can also do it online through our website. But you'll send that explanation of benefits to the difference card. We then process that claim within a few business days, and then we'll send you back payment by either check or direct deposit. So in this situation, I submitted a claim. I'm going to get a check for $2,500 to pay off my deductible bill. So that's the process. It's a reimbursement, but it happens on the front end. For any deductible charge, you're not supposed to pay up front. You're supposed to wait for the health insurance carrier to bill you afterward. you submit the claim to the difference card, we'll send you those funds to pay off that medical bill. Now, if you get a check or direct deposit from the difference card for a medical bill, so let's use the same scenario for $2,500, it's your responsibility to pay off that medical claim. If I get a difference card reimbursement check and I go buy a really nice TV, that's a really nice TV for me, but I still have my medical bill outstanding. So just keep that in mind. Going past your in-network benefits, you also have out-of-network benefits on this plan. So if you have providers that are not contracted with Cigna, you have the same out-of-network benefits you have today. Really, you're only responsible for the first $300 worth of your out-of-network deductible. The difference card, or Berkeley Heights, is going to fund the remaining $2,700 worth of your out-of-network deductible. If you do max out your out-of-network deductible, you'd be exposed to out-of-network coinsurance, and your responsibility remains the same there as well. You're responsible for the first $2,700 of your out-of-network coinsurance, and then Berkeley Heights, through the difference card, will fund the remaining $7,000 of your out-of-network coinsurance. So it's definitely financially advantageous for you to stay within the network. Cigna does have a very, very large network. But if you do have providers that are not contracted with Cigna, you have these out-of-network benefits at your disposal. So I'm going to go through the functionality of how to use the difference card again. Just want to double down on the really the process. So on the next slide, it really shows you what you swipe for at each provider. So you only swipe your difference card MasterCard at the primary care, specialist, and urgent care copays for $20 each. Now, say you lose your difference card MasterCard, you lost your wallet. Sometimes you don't keep that card in your wallet. The credit card machine is down at the doctor's office. You're not penalized for not swiping your card right there and then. You can always get that money back. You can always get the full amount of your benefit. So if you do, and I had this situation earlier this morning, I went to the doctor's office and I forgot my difference card MasterCard. What you can then do is submit a manual claim. You can either get a detailed receipt or an explanation of benefits from Cigna, and then be reimbursed for that copay where you didn't swipe. So there's always time to get the full amount of your benefit. Going to the next slide, it really details line by line, pretty much the manual claim submission scenario I went through earlier. I definitely encourage all of you on the line to create a Cigna member login if you haven't already. Cigna's still your health insurance carrier. That's going to remain consistent going forward. On Cigna's website, you can find a full history of your claims. And you can find those explanation of benefits that we need to really reimburse you for your medical plan. It's as easy as going to Cigna's website, downloading those EOBs as PDFs, going to thedifferencecard.com, and then you can submit a manual claim through our secure email function. So it's really just a drag and a drop. I definitely encourage everyone to do it digitally if they can. If you go to the next slide, there are 4 ways to submit a claim for reimbursement. So I just went through really emailing your claim or doing it digitally through thedifferencecard.com. We also do have a mobile app. So you can also take pictures of your explanation of benefits and submit it through the mobile app. If you do receive paper, our office is based in White Plains, New York, so you can mail or fax your claim. Of course, keep in mind current events. The United States Postal Service isn't working at optimal efficiency, so definitely doing things digitally may be faster, smarter, and just easier for you. So just keep that in mind. So signing up for direct deposit. Like I said, if you submit a manual claim, you will either get funded via a check or direct deposit. Really echoing my claims about the United States Postal Service, it's definitely cleaner and easier and faster for you to sign up for direct deposit rather than wait for a paper check in the mail. But either of your preferences works for us. To sign up for direct deposit, once it's July 1st, which is your effective date, you can log into your member account with a difference card. And then under reimbursement preferences, you can toggle the direct deposit feature and enter your direct deposit information. Now, come July 1st, you'll also be able to make a member account on the differencecard.com. So this is a really great self-serve tool for you. You can check on the history of your claims. There is a customer care chat feature in there as well, but it's just a great self-serve tool. So the first time you register, the website will prompt you, but your username is your social security number and your password is your date of birth. Once you complete registration, you can then reset your login credentials. I definitely encourage everyone to create a member login, but we will follow up, especially closer to the effective date, with more information and reminders. We also have a mobile app, which is something you can download right now if your phone is out. It's called Difference Card Mobile. Similar to the website, you will not be able to register until July 1st, which is your effective date. We will send around a registration code closer to that effective date, so you have that resource for you. I love the mobile app. I use it a lot, and I usually actually download or submit most of my claims through the mobile app because it's really just a click of my thumb rather than having to go online. But that's my preference, but this is another resource for you.
Great, thank you, Scott. So keep in mind that if anything comes up or if you have any questions, especially when you start utilizing the new way of obtaining, maximizing your benefits in July, that you have questions, we highly encourage those to go to Donna. However, please note that you have a variety of different resources available to you as well. You have our benefit advocacy team that's there to assist you with insurance claims questions, with any sort of questions or technical questions, issues or concerns that you may have, as well as Difference Card has a public sector customer service care phone line. So if you're ever in a situation and it's after hours and you can't get a hold of Donna, they're open from 8 a.m. to 8 p.m. and we're more than happy to assist you and help all the employees at Berkeley Heights maximize their benefits.
All right, thank you, Scott and Simone. I appreciate your help with the presentation, and we have been responding to questions as from the other presentations. So thank you for your input. We will be posting this presentation so that I'm sure you didn't get the numbers and the steps, so everything will be online. As Mike said, he also recorded the presentation if you want to listen to it again. This does not impact either your dental plan or your prescription plan. This is for health benefits only, and it is those certain categories that Scott reviewed that are your health benefits. So again, if you have questions, feel free to reach out to me. We are going to post it on our website, but from all the responses I've gotten, we might send it out to everyone also, both presentations. Any other questions right now before we sign off? Okay, and Mike is going to send an email with a link to the video, which is great. Thank you, Mike. We appreciate your help. All right, everyone. Thank you so much for joining us tonight and for your patience and cooperation through this. Again, we're all committed to making sure that this goes through smoothly and that there are no issues for you as an employee. So feel free to reach out to us if you have any questions, and otherwise enjoy this wonderful night and your last few days of remote learning, remote teaching. Thank you.
Good night, Donna.